Hi, good morning. This is Paul again with Management Matters. Yesterday we talked about how some managers or leaders, hiring managers, will actually make a prejudgment about their people before they really know them well or have an idea and say things like, well, I don't think that person's going to make it, or I know right away. Sometimes you know in an hour, sometimes you know in a week whether they're going to make it or not. I think that this is really based, like I said yesterday, in the fact that a lot of managers are prejudging based on their own perceptions, observations, or even their own talent or skills. And what happens is a leader might have some history in the role that the person's actually coming into, and judge the person based on their own talents and strengths. And obviously, not everybody has the same talents and strengths. Not everybody brings the same things to work every day. Not everybody has the same level of commitment or positivity or achiever or values. We have different sets of strengths, but depending on the role. So this is what I'm going to suggest to you. If you're a leader and you have the ever had the words roll off your lips in the first week somebody came to work for you, they're not going to make it. So what I'd encourage you to do is have the people that come to work for you take a talent assessment. Now, if you work for a good hospital or a good organization, they're going to have, your HR team is going to have a talent assessment on people, or you're not going to be hiring people without understanding if they have the raw talent to do the work. Now, if your hospital doesn't have that kind of tool, ask for one. Ask them to come up with one, and there are a number of them that are out there. They're not expensive. They're a great value when it really comes to leveraging the strengths of people. And then after you get those themes of talent, read through them, begin to understand them. Try to picture how those themes of talent that might be most prevalent in the new person might actually be of the most value to the outcomes you're trying to reach with your patients, with your doctors, with the team, peers, the family members of patients, and others. So your first step in this process is going to be try to understand what the themes of talent are just right from the paper. After the person's completed the assessment, get a copy of it, read it, think about it, ponder it, consider it, and in our next entry, which will be tomorrow, I'll talk about what to do with it next, and that's going to be having that first conversation with the talented person that you've welcomed into your work family. So until then, and more Management Matters, have a great day.